we're going to bring into the stream Dr. Lakshman Swamy, ICU physician at Cambridge Health Alliance. It's good to have you here. I want to start with this, the White House ordering the FDA chief to authorize the vaccine by the end of today. Does this really speed anything up? I believe the expectation was that those who were going to get it would start getting it next week, right?
I think that's kind of more of a political move than anything else. So I don't know what to say about it. I think, all the signs are that we're going to be moving forward with this. We've already seen other countries move forward with it. And I think as a clinician, and I think I speak for many of my colleagues here, we feel pretty good about the safety and efficacy of this vaccine from how much we know. And I think really at this point, the risks of letting this virus kind of just go on unchecked are far outweighed by the benefits of the vaccine. I think it's safe enough, and I think we got to move forward soon.
Dr. Swamy, Anjali here. On that point, though, I know that there have been some concerns about not knowing whether or not pregnant women, individuals with allergies, and other concerns. That seems to be what's in need right now for the FDA to sign off. What are your thoughts on what that will be?
I think that having a wife who was pregnant recently, I'm very sympathetic to that. I think if we had everyone vaccinated except people who were pregnant, except people under the age of 17, that would be a lot of people. And I think it's worth moving forward. I don't want to leave anyone out. I think it's really important to think hard about that. But there's probably a way to kind of not have either or here and to move forward with safety and bring people in as we can.
What would you say to the people who are concerned about the safety of the vaccine itself? I mean, the Pfizer vaccine and the Moderna vaccine are not even based on live virus. So does that remove any kind of threat at all to the human body?
Certainly using something that's based on live virus to me is always going to be more risky. There have been cases in the past where live virus has been injected. I think from my perspective, people have very good reasons to be hesitant about getting a vaccine. That's because, in large part, the people who are hesitant are some of the most vulnerable people when it comes to coronavirus. These are Black and brown patients who've been discriminated against by the medical kind of industry and healthcare system for a long time. I understand why people are hesitant. At the same time, it's our job to bridge that gap and to be able to say, hey, I'm your doctor, and I think this is safe for you, and I'm really thinking about you and your loved ones here.
Dr. Swamy, pivoting really quickly to the news out of New York that indoor dining is going to be closed once again. It seems like we're in this cycle, which is something that experts like yourself have already predicted. Is this something that we can see continuing into the new year, possibly until March, April, sort of this back and forth until the vaccine starts getting to the general public?
I think the key point there is the vaccine getting to the general public. In Massachusetts, we're expecting that to happen maybe in the spring. And what that means is that come the spring, we don't expect to have anything close to herd immunity in Massachusetts. And I think that's probably true across the country. So we have to be very careful about acting like we have herd immunity before then. And that goes for our policy making as well. So I think that we are really in this for still the long haul. We have to look at this winter and say, what's the right thing to do? The right thing to do is to really hold back a little while longer. Don't go make that big indoor gathering happen a little while longer. It's going to take us many months to roll this vaccine out and get enough people vaccinated for it to really count.
We're also going to have different vaccines, we all assume, by the time in spring that the general population can get them. There's Moderna. We're going to get Johnson & Johnson's results. I think we might start hearing results on Johnson & Johnson's vaccine in January. Once we have massive amounts of vaccine available, would it make sense to just have the general population report to vaccination centers, say, based on zip code? Or is it better to let the pharmacies and each individual doctor coordinate with the population?
Maybe it's not an either or, maybe it's a both, because I think that the trust that people have in their local communities and their community physicians really matters. And I think that's going to be the way that we get to a lot of people. On the other hand, that's not necessarily something that we can scale rapidly and get the most vaccines to the most people as fast as possible. So I think we're going to need to be very thoughtful about how we approach this to really get vaccine to people, to everyone.
Doctor,
Anjali?
finally, I know that one of the debates yesterday at the Pfizer vaccine advisory meeting was about Pfizer's results, and I've heard different opinions on this. And I wonder what yours is about the idea that Pfizer's could turn into a one-dose vaccine just based on the results after the first dose. I also heard that that's not exactly the way it functions based on how the body is primed and learns to defend itself. So I wonder what your thoughts are on that.
I think what's amazing about this is that, we don't have that much experience with mRNA-based vaccines, so it's very exciting. From a scientific perspective, this is an incredible moment where we're seeing really new sort of vaccine technology moving forward. That said, could things be better than we think they are? Sure. We have very little data, in a sense, compared to what we will have in the months from now. So hopefully things are a lot better than we expect, but I wouldn't plan for that. I would plan based on what we know right now.
Dr. Lakshman Swamy is the ICU physician at Cambridge Health Alliance. Look, if you can survive driving on Storrow Drive in Boston, you can survive this. All the best to you, and thank you so much for joining us.